paper on Pharmacists Changing the Future of Mental Health. It was done by me, Jenna, Slotty, and my partner, Nicole, Wenig.
Mental, neurological, and substance use disorders affect 450 million people worldwide, yet only a small fraction of those people receive the help that they need. Public policy plays a big role in the advancement of pharmacy as a profession. We will discuss in this PowerPoint how pharmacists can aid in the treatment of mental health, since prescription medications are a major method in treatment for many mental illnesses, what public policies are being developed to aid in the advancement of pharmacists as healthcare providers, and look at a real-life example of a situation of a patient's struggle with mental health.
Next, we'll discuss the methods we used during our research on mental health illnesses. For this project, we looked through several different journal articles on the topic of mental health and pharmacy. The articles we used gathered their information by using statistical analysis, surveys, demographic research, public policy information, and an autoethnography. We use this data to determine what can be done to help pharmacists improve the current problems with mental health disorders.
450 million people worldwide suffer from some aspect of a mental health disorder. The biggest issue facing mental health disorders is the small amount of people with mental health disorders who actually receive treatment. For those that do receive treatment, the number one treatment is medication. Surveys show that patients with mental health issues believe that they are not getting the consultation and effectiveness of monitoring that they need to get better with their medications. Some patients said that they went months before having the effectiveness of their medication even evaluated. Pharmacists get to see their patients on a month-to-month basis when they are picking up their medications, and they need to be utilized in order to ask patients questions. The pharmacists are the most familiar with these medications, therefore they should be utilized in treating mental health disorders. In order for pharmacists to adequately get involved, pharmacists will benefit from receiving provider status in order to provide services for proper medication management.
It would be beneficial for pharmacists to be considered providers because there are multiple ways they can contribute. They can do medication reviews for their patients, identify adverse effects of medications, increase adherence by limiting side effects, check with patients on a monthly basis for efficacy, and communicate with other healthcare providers.
Next, we will discuss disparities in mental health. Not everyone has equal access, cost, and quality when it comes to receiving treatment for mental health disorders. The Surgeon General has estimated that about 1 in 4 Americans has a mental health disorder, and 2/3 of those with mental health disorders do not receive treatment. Many groups face unique mental health disparities, such as ethnic groups, socioeconomic groups, gender groups, and regional groups, such as rural versus urban populations. Examples of some of these disparities include rural populations do not have easy access to mental health care facilities, since mental health facilities tend to be in larger cities. Suicide rates vary depending on the ethnic group. And low socioeconomic individuals are 3 times more likely to have a mental health disorder.
One way to increase quality care is by increase in training. This includes training among healthcare professionals and also police officers. Family doctors spend 30% of their time treating patients with mental illness, yet they cannot adequately treat their patients because they're not trained very well. Police officers are often the first to respond to mental health care disruption, but are not trained to appropriately deal with the situation. They also do not completely understand when to remove a person with a mental disorder from a public place.
In conclusion, pharmacists need to gain healthcare provider status in order to help patients with mental health disorders. There are many different services that pharmacists can provide that would benefit patients with a mental health disorder. Public policies need to be put in place to decrease disparities amongst various demographic groups in the United States. Healthcare insurance needs to be standardized for all policies to include payment plans for mental health services. And more specialized training across various occupations needs to be implemented to best help individuals with mental health disorders.
These are the references we used while doing research on our topic.